Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
Hi, I'm Rev Rachel Harrison. I'm the pastor at Northminster Presbyterian Church and also a host here for Encounter. We've changed our programming today, which I think has been a wonderful thing. These folks that are sitting beside me have a lot of resources. We're particularly going to be talking about vulnerable folks during the COVID-19 outbreak and what that means for those of us that are caring for those folks, and particularly those of us of faith. What does that mean? How do we make sure that we see people around us that maybe we're forgetting about, and how are we caring for them? I'd like to introduce you to Dr. Sharon Bryant, who is a professor at Binghamton University and has done a lot with diversity and works in the nursing school. And this is Les Aylesworth, who is the director at Chow, the Chow Pantry, and does a lot with particularly making sure that folks are fed and how that's distributed. So thank you both for being here. I really appreciate you seeing how important this is and being able to share this with our community of faith and also a larger Southern Tier community to say, hey, we see you, we know you, this is scary times, but let's take a deep breath, let's hold each other up, and let's make sure that we can still be community in a new way and do that together. So thank you, I really appreciate you being here. I'm gonna start with Dr. Sharon for a moment. So you teach at the university, but I know that part of it is thinking about diversity and how people are cared for in more vulnerable communities. What have you seen happening, and on the flip side, not happening, in response to what's been going on with the coronavirus?
Well, one of the things that I think that we have seen is the lack of diverse faces around testing. Like, we haven't really seen that testing is going out to underserved communities, that we're reaching out to those communities. Talking to family members a few weeks ago, because we had not seen the face of the virus on African Americans, some people were thinking, well, maybe we're immune to it. That's why I really appreciated when Idris Elba and Kevin Durant came out publicly and announced that they had the virus, and really iterated that part of the reasons why we're not seeing some communities represented is that we're not being tested. It doesn't mean that the virus is not there. It's the fact that we're not being tested. And I think that is really key. Once we realize that all communities need to have access to testing.
So do you think it's a combination of information not getting out or misinformation getting out about that folks are unsure if they should be tested, or is it just not access?
I think a lot of it is not having access. And then there is just the different discussions about what are actually the symptoms, and with so many people being asymptomatic but then being tested positive for the virus, I think people are getting kind of mixed messages about when they actually should reach out to the healthcare providers to see if they need to be tested. But also in underserved communities, the lack of access to healthcare, is still a reality, and it becomes even more so when we see something like this, the fact that they don't have access to those resources.
And those that don't have it and those that do, is there still a little bit of fear that they'll be treated the same if they use the medical system, or is there just sort of skepticism about the care that they'll receive?
Well, I think it's a bit of both. I mean, although the Tuskegee syphilis studies, it's been years ago, but still that same fear and stigma has been a reality for African Americans and other underserved communities. So it does play a barrier, and we have seen in the past with certain epidemics like, HIV and AIDS, how certain populations were stigmatized as if the whole population, subpopulation had HIV or AIDS, and all of the discrimination that was associated with that. So, I think it's a little bit of both that plays.
Can you tell some of our viewers, about the Tuskegee, what happened with that? I know this is part of historical part of the medical system for particularly African American men.
Yes, but that study did not end until the 70s, and those individuals had syphilis, and there was a treatment for syphilis, but they allowed those men to continue untreated in order to follow what would be the health outcomes of somebody who had a syphilis. And so they infected their wives, their children, their communities. And it was, I believe it was 72 when it was finally ended. And you really can't imagine in this day and time that we would have treated a group of individuals so inhumanely. And so that fear is still in the community.
And I hope this is a way that we can start to educate, but also get information out and say, yes, we need help.
Yes.
And I know that Les has been one of those folks that's saying, yes, let's give you help, but let's do it smartly. And I'd love to hear a little bit more about what you're doing with the Chow Pantry to make sure that folks who are vulnerable in all sorts of communities, those who are losing their jobs currently, just unexpectedly, those who don't have income before this, and those who are in vulnerable communities that Dr. Sharon was talking about as well. How is that going for y'all?
Well, that's a great question. We, Chow, which stands for the Community Hunger Outreach Warehouse, is our mission is to fight hunger in the community so that no one goes without food. And we have targeted most of our efforts towards those underserved communities because in a normal situation, we have between 25 and 30,000 folks in the community in Broome County who are food insecure to begin with. And whether they're rural populations, urban centers, groups like that, even on Binghamton campus, Binghamton University campus, already there's a large number of people who are food insecure. And with this COVID-19 happening, we are anticipating that number to grow during this time as people do lose their jobs, as food access becomes limited due to shortages, as we're already seeing in the stores. Right. Elderly folks who already have access issues are now being homebound or self-quarantined, doctors order quarantine because they don't want to get ill. People who are, already have pre-existing conditions like cancer patients and things who are already, immunocompromised, that don't want to be out in the community. So we've been trying to prepare for this for the last couple weeks, and recognizing that these people are going to need food. People who don't have access already need it. And so we've been trying to game plan for that for the last couple weeks. And so what we've done was we realized that we probably needed to have something that was handy. It was easy to hand off so that we could limit the contact with the social distancing, which is one of the hardest things for what we do, because we're all about trying to be, when you need help, you want to be there for a person. And
you want to give them a hug. You want to actually tell them I see you.
A touch is just that. It's a touch, and that could be the worst thing we could do for them. And so this whole thing is very ironic, cruelly ironic, in fact. And so we tried to come up with a way that would limit that, as well as provide meals, as well as to provide an easy way to distribute them. So we came up with these, what we're calling 5-day emergency food kits. And what they are is full of basically every food group, and to get people through for at least 5 days. We know that this situation is going to go on, and that, like I mentioned earlier, the number of people who will need them will probably increase. So we're trying to be prepared for that. So that's kind of what we're doing right now, because we want to make sure people are fed.
So I've heard both of you talk about, okay, we see these people, we know these people, and before we started airing, we talked a little bit how faith communities, particularly when you look at scripture, that's exactly what each faith community talks about, is to see the most vulnerable in our communities. And since this is Encounter, I do want to remind you of that. I'm a pastor, so I just can't get off my soapbox, I guess, but if you're just joining us, I have Sharon, who is a professor at Binghamton University, and Les, who is the director at Chow Pantry, and both of them work to help the most vulnerable in our communities and help educate about that, but also to make sure that there are resources when we're particularly talking about COVID-19 and how we can respond and how we can see folks right in our community. And folks we don't always think about, right, that we should be thinking about, but you know, it's a thing. Sometimes we just don't. And I love that both of you are saying, yep, there's a reason this happened. Yep, people aren't getting information. Nope, they don't all know about this. And I mean, I've heard both of you say that the resources are out there, but they're also limited. And sometimes they're not being given in the right way. And so Sharon, I'd like to go back to you for a moment about that too, to speak a little bit more to that.
Yes, and I think that the equity that's part of my job description, you know, diversity, equity, and inclusion, the equity is really important at this time, because I think we have been focused, like, on the federal government. Some of the policies have been equitable, that we want to provide every household with $1,000 or every family with a certain amount of money. But I think in this particular time, we really need to focus on equity. And that means that certain families, depending on where they stand, how they're under-resourced, they should get more money than a family that has the resources that they need. So I really wish that that whole discussion about putting money in families' hands was a little bit more nuanced, because there are a lot of people who are in my situation who can work from home, whose paycheck will be continuing. And for us to get the same amount as someone whose income has stopped because the restaurant has closed, or the business that they were working in has closed, or the fact that they cannot perform their duties remotely, for me to get the same amount of money as them at this day and time when people are under-resourced, I really feel that we really should be focusing on equity.
Yeah, and actually that made me think of, there's a picture that's been gone around for a while where there was a fence outside of a baseball field. Now the baseball teams are closed right now, so don't go to a baseball field, but maybe go to a park and keep your 6 feet of distance. But the image itself strikes me is that they talk about everybody having the same thing, right? And so there's a taller person, a medium-sized person, and a smaller person, and they give them all a box. Well, now the taller person really can see, the middle-sized person can see, but the smaller person can't see. And then the next picture, they take that same fence, and they have the taller person doesn't have the box, the middle person has the box they had already, and the smaller person gets 2 boxes, and now they can all see across the fence as they can all see. So I think a lot of times when we think about equity, we think everybody needs to get the same thing, but not necessarily. And and that image sort of strikes me because it gives a point of maybe we're the taller person, or maybe we're the smaller person, or maybe we're somewhere in the middle. But what we need may be a little bit different.
Yes.
There's some nuance to that. Have you been seeing that at Chow as well, like that folks are coming in, or is that still pretty?
Indeed, at this point, you know, there's people who are financially okay, and they can make it, and you know, Lord willing, they'll continue to make it. The reality is, we are all called to be decent human beings, right? And If you see a person, like using your analogy of the boxes, if you have, give. If you need, ask. And that's really hard, because especially in times like this, and what I'm seeing is there seems to be this like circling of the wagons around your own person. And we've seen the hoarding going on, and the panic buying that's happening, and it does strike you a little bit of like, I got to make sure I get mine. And I know maybe that's just a survival response. I know psychologists will probably analyze this for decades afterwards.
I'm sure they will, and historians will too.
Yes. And yet, we're still called to be decent human beings, good citizens, good Christians, and to see those who are vulnerable, and to not overlook them because, your needs are met. So okay, whew, I'm good, and then just forget. One of the things we've been putting in these boxes is a little letter from Chow to remind people that we're there for them, that they are seen. And you know what? It may be hokey for some people, but we want people to know that we at Chow see you, and you're not forgotten by us. And if you need help, here's some resources to call. But we just felt that was just an important message to send out to people who maybe receiving one of these boxes, they may be the most desperate place they've ever been in their lives.
Right.
And we want them to know there's people out there who see them, who love them, who are willing to care for them, regardless of where they're at, regardless of their socioeconomical station, regardless of whatever, what Dr. Sharon said about the class or group or whatever they're in. We want them to know that they're being seen, and without judgment, without question, we're gonna. If you need food, we're going to do our best to get it to you.
That's wonderful.
And that's what's nice now about the technology that a lot of us have available, is that we can really still remain in contact, whether we're FaceTiming or Skyping or using any of those kind of video things on our phones or other devices, is that even if we can't be in the same location, we can still see each other's face. We can still be in communication and community. And I think that especially for many elders, where church was a big part of their routine, their weekly routine, and not being able to go to a physical church, but to be able to watch your church service on your iPad or your computer, or listening to it on the radio or some kind of podcast. It's not the same, but it still can provide a sense of community in this time.
And I have honestly been amazed at how church leaders and faith leaders have been really thinking this through, and they've been answering it in a lot of different ways, but to say, we still see you, and how can we reach out and still be connected? Some are trying to work together, some that have smaller churches that don't have access to that. Some are saying, okay, let's try to do something here. Like my congregation, we're doing a Sunday devotional this Sunday. But I know that it's going to look different for each faith community. But I know that, and you both hit upon this, is that make a phone call. If you know somebody that's elderly, or somebody who is immune compromised, or somebody who is really freaking out about all of this, phone call, old school phone call is still a good thing. Say, I see you, I know you, how are you doing?
That's so important. And I've tried to encourage that to people. If you have an elderly neighbor or disabled person in your circle, a network of people be checking on them. Especially, you mentioned social media. If someone is normally on social media and all of a sudden they're not, though you may not be able to do a wellness check physically at their home, you reach out to them. Hey, you've been quiet are you okay? Because I had the flu a few years ago, and I now understand why people die from it. It was that bad. And so if someone is ill out there, again, about being a decent human being, check on your neighbor, contact them, and let them know let them know that you're paying attention, but you may actually save a person's life.
Yeah. So both of you have different resources, so I would love for you to share, if you can share them so folks can hear what you know, just so we can put it out there. So I'll start with you, Les, and then Sharon, I'll ask you to also share, so we both have different resources that we can share with the broader community. So we talked about Chow and what Chow's doing. You know of any other resources that Broome County Council of Churches is providing?
Well, I can mention this in a large thing. If you dial 211, they can get you hooked up with all kinds of services, housing, food, etc. And it's a great resource if you are just needing help and you need to find out what resources are out there in general. At the Broome County Council of Churches, and Chow focuses obviously on food and making sure our pantries and meal sites are stocked. We have over 100 in the community that are basically running every day of the week. Thankfully, most of them, the vast majority of them, are holding the line. They're still functioning, they're still operating. The attitude of our folks out there, I call them our boots on the ground, they have an attitude, we're going to keep going. Even as their churches aren't meeting, they've gotten exemptions for their pantry that's the one thing that will be open. And I just really appreciate that attitude, that they love the people they serve and they are not willing to stop.
Northminster actually did that. We closed our facility, and there were two things we kept open, was Al-Anon and Chow, because we felt like those were vulnerable communities. So
that's we have those resources still ongoing. We also have at the council Faith in Action, where we connect with seniors, giving them rides to doctor's appointments. I know a lot of doctors have canceled, regular appointments because they're trying to prepare for influxes of other stuff. But those are two of the biggest things that we do at the council. So those are resources that we have, and we can be reached at 724-9130, and we can, whatever your need is, we'll do our best to either redirect you to someone who can help you, or help you ourselves. So that includes, even we have limited supplies of diapers there.
So that was going to be my next question. Are there things that you all need?
Formula.
That could be
those are things
donated?
that would be great to have, because in fact, a lady came in this morning. This is a Thursday morning, and because they were desperate. There's no diapers out there. They're all bought up. All the formula's bought up, and they have a 4-month-old baby. And thankfully, they connected with one of our employees at Chow, who said, "Hey, we have some diapers." They came this morning, got them, and so we were able to make that happen for them. And
so friends, if you have diapers and formula, please bring them to your local Chow pantry, or you can bring them to the main Chow pantry, and it will be used. So
absolutely.
I appreciate that. And I'm sure there are other things as well.
Yeah, there's plenty of financial donations are really helpful for us at this point too. So if people are thinking about us, but those are basically the resources that we're tapped into.
Thank you, Les. Sharon.
I guess I would just echo the resources at the federal government level, like the CDC, that has a COVID website that's updated. At the university, we have a coronavirus COVID-19 website that is updated daily for students, because a lot of our students live off campus, and it's continually updated so that they know that the resources, plus many of the supportive organizations, like I'm the project director for the Collegiate Science and Technology Entry Program, and there are other programs like that are focused on underrepresented students, like LSAMP and McNair, and we have all put on our information either on our websites or through emails to our listservs to let our students know that we are available, and we surveyed our students at the beginning of the week to find out some of the needs that they had, so that we can begin to try to address them.
And did you say too that NAACP is also
yeah,
offering
the NAACP last Sunday, they had a teleconference which provided a lot of information that was geared towards vulnerable communities. I was really happy to see that they focused that, because we have not specifically in the media targeted vulnerable communities to put information that was directly focused on their needs. So it makes me think about how much of this information is in the various languages that people speak.
Right.
For people who, in which the regular media, they're unable, people with vision issues and other things that might need the media to look a certain way for them to be able to get that information. How are we kind of outreaching to all of those kinds of communities?
Thank you so much. And friends, this has been just such a pleasure to be interviewing and speaking with Dr. Sharon Bryant and Les Aylesworth. Dr. Sharon Bryant works as the professor at Binghamton University, particularly in diversity and the public health and part of it, and also Les works as a Chow director. And both have been speaking about how we can respond as people of faith, as just good humans, to make sure that we're seeing people that are within our communities, how we can help them. And they've also offered a whole list of resources between the university, Binghamton University's website, to 211, which is United Way's phone number, to Chow Pantry, and also how you, if you have resources, how you can share. I know that Chow particularly would needs more things. We heard about diapers and wipes and formula for babies. Also, money is always good. I think they can use it and they'll find a way to use it. Checking in on your neighbors, seeing who they are. And your neighbors can be the folks who are right next to you, or neighbors can be people that your faith community has identified that need help in a lot of different ways. So I encourage you, even if you're stuck at home, to find a way to be Christ to someone else, to show God's face to them, to not be afraid in the sense that you're panicking, but to share what God has given you, and to see your neighbor as they are, for we are all beloved children of God, and we all need help, and we're all probably a little bit scared. But if we can rest in the sure assurance that we are children of God and that we can share what we have, there's tons of ways that we can be a whole lot better together, and we can show the best of ourselves instead of the worst. So don't let fear take this over. Pay attention, be a good neighbor, be smart, wash your hands, but see each other. God bless you. Bye-bye.